My name is Dr. Frank Urasek. I'm an acupuncturist who's been practicing for the last 39 years. And I've done many different kinds of protocols and therapies. But the one that stole my heart very early in my practice was a therapy that was developed by a Korean doctor, Tai-Woo Yu. And he discovered this therapy out of need. He had a blinding headache. He held his hand up in front of his face in the dim light of his bedroom, and he discovered the principle of Tzu-Chi. The back of my middle finger, at the end of it, looks like the back of my head. I wonder if I put a needle there, it will do anything. That was in 1970 something, and it did. And the history of our medicine changed because he interpreted that discovery as a mission that was given to him to put the ability to heal oneself in one's hand, in one's grasp. So that gives us tremendous power as a healer because we become teachers. We demonstrate, we discover on ourselves, and we pass that information along in the care of our patients. And so kind of a nickname that I've given to this therapy is first-hand healing. Second-hand healing is when someone else does it to you with something else. In first-hand healing, you are doing it on yourself, to yourself, and you have control. And so what we're going to do is go down this little journey in the next few minutes as an overview to this class, which I call holographic therapy, like the hologram. The principle of the hologram is that the part contains the whole. Any part. In a picture where you cut out that negative, if you go to the house with the chimney with the smoke, you can cut anywhere on that negative and shine a laser through it and recreate the whole picture. That's the power of the hologram. We can do the same thing energetically with our body, whether it's the ear with the Noget system, the scalp with the Zhu system and other scalp systems, the face, the hand, the abdomen, and Sacred Turtle. They all work on the same principle that the part contains the whole. So that's overview. There's another wrinkle here. So this week I'll be presenting, we have 3 posters from the hospital I work at as director of acupuncture. We have one on the use of the ear of auricular medicine in the treatment of long COVID. We have another one on the use of these microsystems that we're talking about, the holographic systems that we use in ER on a government grant with tremendous success. That's already been, out of the 114 posters, singled out for featured presentation. A third one is on suicide and the role of ketamine, horse tranquilizer, and auricular acupuncture as the break on that hallucinogenic therapy, and psychological counseling. So the point is that we can either act alone with these parts of our body or very intimately with other parts of medicine in an integrative model. And that's the power of this. These therapies are based on 2 things, principle and precision. So we have a principle that the part contains the whole. We have the precision of those parts on the hands that we can find to stimulate a healing response ourselves with direction and education at any time, anywhere. And for the same reason, we can do that with our patients and jump into the $160 billion telehealth market using their hand. They say the definition of a consultant is someone who borrows your watch to tell you what time it is and charges you. We borrow the patient's hand, we borrow the patient's body part to show them how they can heal themselves firsthand, and we charge them. So let's take a look at some individual things here. Let's take a look at the hand itself and see how different parts of the hand correspond to parts of the body. The beauty of it is it's very simple to remember because the front of the hand is the front of the body and the back of the hand is the back of the body. So we do a lot of skeletal issues, Neck and low back are probably 60% of the problems we treat. And you want to, there's that 80-20 rule where 20% of the things you are involved in are affected by or experienced by 80% of the population. So I have to tell you that neck and back and arms and legs are 90% of the problems with pain that you'll be dealing with and teaching your patients how to use it on their hand. So let's go ahead and continue to map out the hand because this will be the guts of our presentation of our class that'll be coming up on the 27th of this month, 7 hours, from 12 to 7 with breaks. And it'll be an intensive, and you'll be able to follow along because you'll be using your hand. And probably one of my favorite tools, if you can come with the Bic pen, because I call it Bic therapy, And I'll show you how to take an instrument like this and rewrite your patient's health and rewrite your practice. So they present and they say, I have neck pain. And you take the pen and put it on their hand, but show it from yours because, again, we can be doing this from Zoom or from Google Chat or Google Chat or any number of ways to communicate with visual, And you're going to tell them to take the pen and roll down that area of the neck, which is between the middle knuckle and the end knuckle. That's the cervical vertebrae. And this will be very clear in the map that's in the background and on the little handouts that we'll have, until they find or you find for them, because it's good to have them come to your office first and then follow up with home visits, Probably on a 30% to fine-tune in your clinic and 70% at home. But you roll the Bic pen down to find the ashi, the ouchie point. And once you find it, don't stand in front of them and be threatened with a spontaneous kick or punch. I learned that the hard way. But once you have that feedback from a change of look on their face, then you'll know that they have found, or you have found together, that point that represents that part of the body that is blocked. Because that's all pain is in Chinese and Asian medicine, is blocked qi and blocked blood. You find it, and you take the tip of the pen, and you press that area, in that area, until you find the sharpest point. And that will be uncomfortable. And make sure you support the back of that hand so there's no give in it. Maybe it should be on a table or it should be supported maybe on their body, so that when you press, there's no give. It heightens the response. And once you find in that exploration, that point, then you put a little X there, and now you've got the treatment point. And you've just shown them what to do at home with any number of other ways to stimulate that we're going to go through next, that you're going to learn in this class, this intensive. So that was pressure with a Bic. Everybody has or can get a Bic pen. Be careful, you don't want to advertise Bic therapy, because the big boys will be on you wanting some of that money. But you can certainly talk about it, talk about the use of the simple Bic pen to rewrite their health. So, the most energetic thing, or one of the most energetic things, the tool that Noger used with his auricular system was intensified white light. Well, then the laser therapy came out with a very specific energy wavelength, amplitude, and in different colors. Green is the best color for the hand and the ear. And so you would find, let's say that same point, let's go back to the neck again. You would go back to that point, and you would find that point, you could put it right up on the point, and ask them how the area that's affected feels. Very important. And you don't, the simplest way is to say, after you've used this and have them move the neck, if that's the area, does it feel worse, better, or the same? You want to elicit feedback so it can control their therapy and your therapy. And it's not a one-shot deal, and it's not all done in one setting. You want to tell them that what you're doing is you're moving the energy using outside energy, and what's called the neuroplasticity, which is how this works, by the way, another principle. It uses attention. I have this pain on the back of my neck. I have this attention on this area of my body that relates to that was discovered by Taiwi Yu and has 250,000 practitioners in Korea alone that use this medicine. So I have an intention, I pay attention, and I have an intention to restore function. That's the neuroplastic piece. What fires together, wires together. You're literally rewriting the software here because you have more connection with the hand from the brain than any other part of the body due to the opposable thumb and its communication to the other 4 digits. So you take that connection, you have an intention to restore function. Now, if I was doing this on the back of my neck or using needles on the back of my neck, how much function could I simultaneously create? None, because the needles are in the way. So the beauty of the holopathic system is that you can exercise the area while you are stimulating the energetic point precisely that was discovered up to 5,000 years ago and moving forward in the 50s with Noger and in the 70s with Taiwi Yu. So you stimulate the point, you have an intention to make a change, and you rehearse. A-I-R, air, is the principle, another principle of neuroplasticity. Attention, oh my God, that hurts. Intention, I want to fix that, taking this energy and putting this in this energetic well and stimulating it, and our rehearsal. These are principles you will learn in this intensive on yourselves and interacting with each other. Okay, so now we had light in the equation. Let's go to one of my faves, this $16 heat lamp that's used for insect bites that you get at online. You can get it, or you can get it from Walmart for $16. Online, they usually sell a couple of them together. So it uses a little red light as a heat gun that duplicates the precise heat of moxa, and does that in 10 seconds. And so we'd find that area. So I'll give you a great example. So a veteran, I treat a lot of them, and I show them how to treat themselves, has diabetes, is concerned. His A1C is high, his daily blood sugars are high. And I show him the DiMi points that I learned from a third-generation diabetes specialist who worked with me in the inner city of Chicago, where he routinely reversed diabetes. And we took it one step further with Taiwo use technology and the technology of heat, which Taiwo uses a lot, and it's very safe. It's non-invasive. And I showed him how to use the DiMi points on the palm of the hand till it was hot. You don't burn yourself, huh? You take it off when it's hot. Maybe that quickly, huh? And you move across these 10 points on the abdomen, on the middle burner, and doing that daily, twice a day. He's no longer on, and this is not quotable, but for this person, his metformin, which would then have changed into insulin, which would then have changed into an insulin pump, which have then changed into going and have his kidneys pumped out every day. Huh? So the point is, first-hand healing works both on the structure and on the organs, and using the principles of location, neuroplasticity, and when we get into balancing all 12 meridians using the 5-element system, another system, and the 4-needle technique of Korean acupuncture, becomes a way to address all the organs and the emotions and the significant illnesses of the body. That would not be in this class. That would be in phase 2. So that's the overview. You'll learn enough information to get you started in this on yourself. So yesterday, I wound up getting 9 stitches on this hand, thanks to a pit bull that wanted to eat my dog. And I separated the 2 dogs before they got too close and killed each of them, one killing the other, and crashed on some rocks that crashed my hand up. So how would I heal myself? This area hurts. So if we look at the chart, the left hand is, or the left arm is the left index finger. The right arm is the right index finger. The middle finger is the throat and chest, or the cervicals and thoracics and spine and lower spine. So I would go to this part of my body from this finger, the index finger, and go to the end joint. So that area I could treat, again, with whatever tool I wanted to. On the opposite hologram, I am now treating here my left hand, the outside edge of it, with the laser, treating myself to heal another part of my body quicker, neuroplastically. So these are the principles. This is the precision. You have a lot of choice here. Another great device, this ion emitter. And I've supercharged it with a magnet. So I've magnetized the ions as they come down to the end, because Notre Dame Aeronautical Engineering Department found that most traumatically injured areas lose their north-south alignment. Another principle. They lose their polarity, and a beam or a stream or a current of either electric or magnetic current repolarizes those cells and speeds up healing, as discovered in their study. Another principle. So I would take the magnetized ionized beam from this device and go to the area, in this case my left hand, which was injured on the rocks last night, and stitched up at 2 o'clock this morning, using first-hand therapy. So please go to Fasoma's site, take a look at our fuller explanation of this on Chicago College of Oriental Medicine's site, and we'd love to see you, because you would reinvent your practice, you would reinvent the health of the people you treat, being able to do it both on them and teach them and use telehealth as well. It's a triple play. So join us. Thank you very much for your attention.